Hello, my name is Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and Warnium 9000 on Reddit. So I cover nursing related topics that's going to help you for the NCLEX, for your next attempt, or your first, or nursing school. So I have like playlists of like fundamentals, which I'm probably going to redo like maybe in a month or so. And then I have like a playlist for the med surge where you're comparing and contrasting the different diagnoses that sound similar and where you're going to find them on your case studies and gen style questions. I have a playlist for the pharmacology, which, speaking of pharmacology, we're going to do maternity pharmacology, and I am currently building on a maternity newborn playlist, which is up and running at the moment. So there's that. If you get tired of before I get there, so those who are trying to get to nursing school, I do have a playlist for the T's, but I'm not the one who made them. That's from years ago, but I think they can still be beneficial. So go ahead and take a peek, look at the content that's going to help you, and yeah, be helpful. Now, you get bored of my nursing stuff, my annoying nursing related materials. I have a playlist for Love is Blind, like my reactions from seasons 1 to 10, and it has its own separate playlist. And I have a playlist for the reality TV shows. I'm going to make a playlist for the Ultimatum, which I'm going to cover the season 3 one. So I did take a bunch of notes, and I forgot how much it dragged. It dragged so much, but I'm looking forward to covering season 4, the current season we just finished watching, and say my thoughts, because I already finished that and I have a lot of thoughts about that one. So keep in tune. Then I have documentaries and stuff and movie reactions. Like the only one I reacted to was the Bright Wonderful Creatures or something like that with Sally Field and Bill Pullman. No, that's the son. And the Michael movie, so that's up there. And I do say my thoughts and opinions. So you are interested in wanting to hear more of my thoughts, or if there's a particular thing you want me to react to, just send me a message. That's what my handles are there for in the description. So today it is going to be pharmacology, maternity pharmacology, things that you should be aware of, because they will pop up with certain pregnancy complications that I did cover in the last video. And you will see them in your probably choices and you have to figure out the right medication that's going to help that patient with, depending on the complication they're dealing with. Okay, so the pharmacology for the maternity, it is a must for the NCLEX. You need to know, you need to be aware, especially with your Q banks and stuff like that. Very important for you to be aware of. So I'm going to cover these. Okay. So here are the medications for the pregnancy and labor, which we're going to go through the stages of labor next week, and the fetal arrhythmias next week as well. So that'll be all one big lecture. Okay, so pregnancy and labor. We have oxytocin, which I'm sure you all have heard of, and generic name would be the Pitocin. So it induces and strains labor and controls the postpartum bleeding. So with which we're going to go over, I think, in 2 more videos. So there is an assessment that a nurse should be doing with the postpartum patients, because they could have what's called hemorrhage, and they're supposed to be there should be a certain amount of color and fluid when you're assessing the lochia each, like postpartum, like days after they give birth. So that's very important. Okay, and oxytocin is used if there is postpartum hemorrhage. So we will talk more about that, like, again, in the next 2 videos. So we want to monitor for contraction, fetal heart rate. So this is before the postpartum, rather, like when we're talking about labor and whatnot. So stop the infusion for the urine tachycystole, which we're going to get into next week, or concerning fetal heart rate changes. Again, we're talking about that next week. We're not going to talk about now, but that's very important. Keep that in mind when we do get into that next video. So to me, contractions or fetal distress, you want to turn off the oxytocin first. Okay, because you could see this could be happening with recurrent late decelerations. Again, that's fetal arrhythmias that we're going to get into. Prolonged decelerations, significant bradycardia, or a non-reassuring fetal heart rate pattern. Again, we're going to see that. So that's when it's going to be useful, right? So signs of the uterine rupture would be sudden pain, severe pain, which we talked about, bleeding, and then loss of fetal station and abnormal fetal heart rate. Okay, I hope that helps. Okay, then we had the dinoprostone or misoprostol. So that's could induce labor, ripening of the cervix. Ooh, that sounds painful. Monitor uterine activity and fetal status, very important, especially when we're talking about labor. So avoid the misoprostol for cervical ripening in patients with a prior major uterine incision because of rupture risk. All right, hope that makes sense. Then there's a terbutaline. So this is another one that I know I've heard about at the time when we were learning about maternity, newborn. So this will relax the uterus during tachysystole and may temporarily delay preterm labor. So that's someone that's going what's called PROM. That's premature rupture of membrane. So we talked about that last video. So that will be given to hold it off. Okay, so the best way I'm gonna help you all remember this, because oxytocin and tuberculin were the two that I had to definitely remember, right? So the tuberculin is going to try to stop it. Think of when you're in a plane, right? Then you have like the turbulence. You want it to stop because it's like going on and on and on and on. And oh my God, don't get me started. I'm actually afraid of flying, believe it or not. And the turbulence scares me a lot. I'm not going to lie to you. I am so scared of heights. It's like my friends kind of laugh at me about it. I'm like, I'm sorry. I just hate knowing that we're up in the sky really high and all that shit's happening, okay? Like, scary. And then the oxytocin is going to encourage labor because you're trying to get the baby out. So I hope that makes sense to you. All right? So watch for fetal. So watch for maternal tachycardia. So definitely keep an eye on the blood pressure. Remember, over 140 is where you need to definitely monitor the mom. Over 150 and above, that's tachycardia we're talking about. Tachycardia would be above 100 and more. Tremors and hyperglycemia, okay? So watch out for those with terbutaline. Then there's nifedipine. I'm so silly. Tocolytics used to delay premature. So what I just said, it's to delay the preterm labor, because there could be a danger to the baby and it's too early, too soon. Monitor for the hypotension, dizziness, and headache, okay? Because it'll bring the blood pressure down. Okay, now this we've already talked about when we're talking about preeclampsia and eclampsia. So this is magnesium sulfate. So remember what I said the last video. It's what it does is prevents the seizure, which will eventually become eclampsia. All right, and you may provide fetal neuroprotection around this time. So what you want to do, like I said, monitor respirations, because what I say the last video, under 12, well, likely under 10, depending on your institution, you may have to give calcium gluconate. You want to check for the reflexes, urine output, the magnesium level, because this is magnesium we're talking about. So, and with the toxicity, it's the absent reflexes, respiratory depression, and decrease urine output. So remember what I said then today. The note again. Sometimes I can't talk. But remember what I said again, calcium gluconate, okay? Betamethasone, this is very important, especially when we're talking about PROM or any sort of early labor complications, okay? When it's too early. So this promotes fetal lung maturity when the preterm birth is expected. So it may increase maternal blood glucose, okay? Just heads up there. Penicillin G, that's the first line of intrapartum prophylaxis for Group B staff. So you want to check for, because this is an antibiotic, you want to check for the allergies, and you want to administer this during labor according to the protocol that's in place, okay? And remember, every institute's different, every hospital's different, so follow your policy no matter what, okay? Labetalol treats severe hypertension. So there's a lot of category X, which I'm going to go to in a few minutes, but that's the safest one you can give for severe hypertension with maternal patients rather, sorry. So monitor for blood pressure and heart rate, and you want to use with caution with patients that has asthma or bradycardia. Remember, it's a beta blocker. And if you know anything about beta blockers, you want to definitely make sure to use this cautions because it can compromise the respiratory status, okay? Hydralazine treats severe hypertension. You want to monitor again hypotension, headache, and reflex tachycardia. And then we have methyl dopa used for chronic hypertension and other agents as preferred. So it depends on what the provider thinks is best, okay? RhoGAM, very important. Please pay attention to this part. So it prevents RH sensitization in an unsensitized, sensitized RH negative patient. It's commonly going to be given like around the 28-week mark, and it is also going to be given within 72 hours of delivery. So given 28 weeks. So remember that when you see that's in your next question about the RhoGAM and the RH negative mom, the RH positive baby. Then it's given again within 72 hours. Within 72 hours. Those are the two magic things you need to remember with those. After delivery, if the newborn is RH positive, and as well as after certain sensitizing events. Okay, so these are the I think these are the vaccines you want to give when we're talking about postpartum, right? Rubella given postpartum if the patient's non-immune, it is live, so you don't want to give any live. So please pay attention to this part. What I'm about to say: don't give any live vaccine when the mom is pregnant. All right, during pregnancy, we're not giving that. Okay, so if you need to give any vaccines live, that's given postpartum after birth. Varicella, same thing, that's postpartum, not during pregnancy. Now, category X. I'm not sure if this is still really a thing, but these are the medications you really want to avoid, and I'll give you a list in the description. You want to avoid to give with pregnancy. Because it's going to cause harm to the fetus. So that's what I remember learning while I was in nursing school, okay? So these are the ones you really do not want to give, or you have to question the doctor with these prescriptions, okay? So I'm going to start with isotretinoin. I believe that's for the acne. And they have to do pregnancy tests with this medication. I remember this because this was like one of the questions I had on my Q banks for you, or your world's excellent, by the way. And it goes right into that. So you don't want to be giving that. So I want you to remember that part if that comes up in the NClex or your Q banks. Methotrexate, do not give. Misoprostol, finasteride. So those are given to males, but a pregnant nurse cannot administer that medication. I remember that because they had to wear gloves. So a pregnant woman should not be giving it all, gloves or not. They cannot. So it has to be someone who hasn't given birth yet or who is not planning to have kids to give that to a male patient, because that's category X. Misoprostol, Oh, I just mentioned that. The statin, sorry. I'm so sorry about that. It's the statin, so your atorvastatin, your simvastatin, that's category X. Use that with caution. Avoid that. Not use caution. You're going to avoid that. Warfarin, aka Coumadin, avoid that. ACE inhibitors and ARBs. So beta blocker, the beta block, that would be good to give again. Labetalol, but you have to use caution, especially when talking about someone that has asthma or any respiratory issues. Okay, so that's all. I'm going to leave a list of any more category X meds for you to know. I'm going to leave some links, of course, if you didn't get much of it. I hope this was very helpful. And next week I'm going to talk about the stages of labor, the fetal arrhythmias, and the postpartum complications. So that's what will be coming up for the next one. So take it easy and have a good rest of your day. Bye.